We'll go ahead and get started. Thank you so much for joining today. Very grateful for Microsoft Viva's partnership with the Leapfrog Group. We've been part of their Partners Advisory Committee now for the past year, and for them being gracious enough to host this webinar today. I'm also really excited to have two very important Microsoft Viva Glint customers that I've been able to personally work with for the past several years share on the topic of culture of patient safety, and specifically how they've influenced that culture through listening to their people regularly, making changes based upon their survey feedback, and trying to improve the overall experience and culture at their organizations, and simultaneously influencing culture of patient safety in the meantime. A few housekeeping issues very fast before we jump in. It's a big group, so we're going to go ahead and go and put your questions in the Q&A, which is down to the bottom right. You'll be able to see that. We'll address those at the end of the session. We're going to try to wrap up with about 15 minutes left today, or 10 minutes left, and we'll get to those questions then. And we're going to be providing you with a copy of the slides, which I think is in the chat right now. But also the recording will be made available to you if you registered, obviously, 24 hours from now. So be on the lookout for that as well. Next slide, please. All right, so presenting today, we're a little bit out of order here in terms of the pictures. Rachel's going to kick things off for us today. But Rachel Crosby, she's the Senior Director of Risk Management and Patient Safety at Kaiser Permanente. She's in the Northern California region. She's been in healthcare for 35 years and resides in the Central Valley of California. She received her master's degree from Purdue University in Healthcare Administration, emphasizing risk and patient safety. Her portfolio focused really heavily on culture, and she's currently working to bring high reliability training to all of Northern California. So she'll be kicking us off. Then we'll follow up with Janelle and Brian from Corewell Health. Janelle Miller is the lead of the patient safety at Corewell Health in Western Michigan. She's got a bachelor's in healthcare administration and is also a certified professional in patient safety from the Institute for Healthcare Improvement. She's worked at Corewell Health for over 15 years in various roles. She just actually started a new role, we just learned. And her passion is to improve outcomes for engaging leaders and team members to foster culture and develop processes that support teams in harm prevention. And last but certainly not least, somebody who I've had the pleasure of working with since 2018, I think it's been Brian Snikaitis. He leads Corewell Health's team member surveying program, so he covers it all. And in this role, he designs and analyzes surveys that measures various aspects of employee satisfaction, motivation, well-being, and he provides consulting and guidance to leadership on how to utilize the data and insights from those surveys to create and implement effective actions. And I will be your moderator today. My name is Ryan LeBeau. I'm a Principal People Science Consultant at Microsoft Viva Glint. If you're kind of wondering what Viva Glint is, we're a group within Microsoft, and our employee success or employee experience platform helps organizations improve engagement and performance with recommended actions and data-driven insights from employee surveys, really across the employee lifecycle, right? From onboarding surveys to engagement surveys, from safety culture, patient safety culture to exit surveys. We do RN excellence for magnet accreditation, you name it. And I've been with Viva Glint for 6 years, and I've been in the employee listening sort of space for 20 plus years. And a good part of that has been with a specialized focus on healthcare. So moving on to slide 3 for the learning objectives today, we'll jump right in. Rachel's really going to be talking about some of the internal research that they've done supporting the impact of workforce culture and engagement on patient safety. She's going to share what they've done at Kaiser with you. Number 2, Brian and Janelle are going to talk about really their journey in terms of effectively transitioning to a new culture of safety survey and results platform. And lastly, both organizations, both panelists are going to be talking about really how to align employee experience with safety culture, the why and the how of it all. right? So, but before I do, just wanted to talk a little bit about employee experience and culture and how that kind of dovetails with safety culture. But early in my career, before I got into sort of company to company consulting, I was an analyst. So one of my roles was to do what we would call linkage research with organizations in all industries, all shapes and sizes. And this entailed basically taking employee survey results and linking their attitudinal data with actual organizational outcomes like turnover, financials, patient experience, or customer experience, and oftentimes safety metrics. And one thing that I found early in my career, and it just kind of happened by accident, I wasn't really looking for this, but some of the strongest relationships I would find would be between, engagement, communication, good teamwork, open and honest environments, and some of these safety metrics like falls, OSHA injuries, incidents reported, these kind of things. A healthcare specific one was pressure ulcers. We saw a lot of correlations there, right? And so when we decided to develop our own instrument more recently back in 2019 at Viva Glint, when we did the lit review, a lot of those early findings were kind of validated. Researchers have been seeing this for a long time and seeing clear links between a just culture, a reporting culture where people aren't afraid to speak up, right? And a learning culture that learns from near misses and mistakes, engagement, and also, safety culture within their organizations. And the stakes are very, very high, right? We also learned, and this was kind of to my shock, recent studies indicate that up to 251,000 deaths are due to medical errors in the United States on an annual basis, right? And I've seen similar estimates from different researchers as well. So stakes are very, very high. And one of the things we also wanted to learn when we were developing this instrument, we asked a lot of our customers and even some of our non-customers, how often are you going out to your people and surveying them specifically about the culture of safety within the organization? Because we want to hear from employees, right? We want to know their viewpoint and perspective of the workplace because they have a unique perspective of it. They can spot potential issues that could impact patients in an adverse way many times before administrators or leaders can, who are maybe a little bit more removed. And the typical answer we got back was, every 12 to 24 months, which was very surprising to me. It was even more surprising because we found, at least one study, a couple studies actually, that showed, that the safety instruments' ability to predict actual safety incidents tended to expire after a couple of months, right? Survey results are in many ways like a loaf of bread, right? You leave them on the shelf for too long, they tend to go bad, right? So that brings us to our panelists today, a couple of, again, Microsoft Viva customers who have really taken a rigorous approach in reaching out to their people more often, more frequently, and using technology to really leverage those links between employee experience and culture of safety. So with nothing else, I will turn it over to our first panelist of the day, Rachel Crosby from Kaiser Permanente. Thank you.
Thank you so much, Ryan. And I want to say thank you to you for your partnership with me over the last few years and really help us answering that question of how do we know, right? And also the Leapfrog Group for letting us know how we're doing in our mission to provide that high quality, safe care that we strive for. And an organization's culture is really that crucial determinant of employee behavior and patient safety. And having that strong, positive patient safety culture within an organization is really essential for that high quality care and effective medical error reporting and reduction. A culture of patient safety is characterized by shared perceptions, beliefs, and values that really reflect an organization's commitment to safety. And it comes from the organization's collective and individual actions that comprise that patient safety management framework. And it's evidenced by services and outcomes of the organization. So a patient safety culture, it has several characteristics, including good communication, emotional intelligence, teamwork, conflict resolution, safety compliance, avoiding drift, and having that climate that just is holistically around safety. High scores in a safety climate usually indicate good communication about errors and that eagerness to learn from errors, appreciation of the risks of working in a challenging healthcare environment. always work in those high risk environments, and that vigilance every day, having that vigilance. So generally, these characteristics represent a positive patient safety culture that is associated with superior employee performance. AP NorCal, Kaiser Permanente Northern California, we actually have identified two complementary approaches to performance excellence. High reliability science and behaviors, which I'm going to talk about in a few minutes. It's also on the slide, supported by evidence-based leader standard work and daily management systems, such as intentional leader rounding, visual management boards, people pulse surveys, and celebrating what goes right and making it easy to do the right thing. And when we talk about daily management systems in conjunction with high reliability, it really means the how to achieve that high degree of consistency and being tight as an organization and delivering our mission. And it really starts with all of us as leaders by leading by example. And it sounds so easy, doesn't it? But really isn't it? Intentional leadership and high reliability is an intentional way of leading. So during all of our leaders and staff alike go through a very comprehensive leadership education on high reliability and daily management systems. To reinforce those leadership driven activities that foster and support high reliable culture. We strive to organize in such a way that we can quickly detect, understand, design, and laterally deploy improvement when challenges arrive or when there's drift. Leader standard work builds in that sensitivity to operations so leaders can in real time recognize and reward behaviors and processes that we want hardwired in the organizations, and we can mitigate quickly emerging risks. So for continuously effective and productive, high quality employee, if you want all these strategies are embedded and aligned within our program. When we have that, that's how we engage and retain those high functioning employees. And as such, we focus in depth on those direct relationships between employers and leaders, and the employee and leaders, as well as the most common human resource strategies of selection, training, hiring for fit, performance management, incentives, and employee wellness, and an organization's culture and systems of involvement. And if you look at the slide, this really supports those 5 principles of high reliability. First, that preoccupation with failure, where we really look at those near misses as opportunity I was talking about, where leaders and staff are really aware of the state, not only when it comes to patient safety, but also the well-being of our employees' safety. Having that reluctance to simplify, where we really dig deep for solutions and not easily explain away errors. Having that commitment to resilience when we're faced with challenges, and during a disruption, it's going to be very short and we can really quickly recover under any contingent condition. And what I believe to be the most important, what we're talking about here with culture, is that deference to expertise, where team members and organizational leaders actually defer to the person most knowledgeable and relevant to the issue they're confronting, and really giving them that platform and a safe environment to escalate their concerns with confidence. So how do we lead to reliability? Well, first, you have to learn the 5 principles of high reliability and actually what they look like in action. And then I'm going to go back to, how do we answer that question? How do we know? And as leaders, we want to know, how do we design for reliability? What does it look like to see it in action? If performance is not sustained, what principles were not incorporated in that design? And how were we managing that risk? How do I model and reinforce high reliability behaviors that I want hardwired in the organization? And you can go to the next slide, please. I love this slide because what we're talking about is high reliability organizations use various strategies, right, of involvement to reduce risk and improve patient and staff safety. So how are we doing it? We use 2 general opportunities to improve safety and quality. One is that vertical tactical approach in a specific area, And we've been doing this for a long time through our clinical programs and improvement initiatives. You can see that our central line bundles, our EVS protocols, environmental services, our sepsis, how we do our IT network and security, our hand hygiene, clinical and non-clinical processes alike. And we do that. But the other, as you see on the bottom, is that horizontal cultural approach. And this is where we achieve that strict adoption of these evidence-based practices and these safety interventions. And both are very important. We need to look at both of them, because without a well-defined tactical bundles, which we're held accountable to, there's going to be variation. But if we don't have that strong base culture of behaviors, none of these tactical bundles will ever be implemented as we've designed. So we look at our Glint People Pulse. We look at what our employees have to say, and they are really interested in being part of the solutions instead of just being part of the status quo. So we want to hear from them. So if you can go on to the next slide, I really want to share some really awesome data that I have to share with you. And this really represents how Kaiser Permanente, twice a year, we use our Glint People Pulse data. And this represents the top 20% of the departments that scored 81 or higher with that staff comfort of speaking up. And this is what we're always striving to get more and more and more of, right? We want to increase this. We want our employees to speak up. And when you have this culture of speak up, and it demonstrates a decreased severity of harm, better care, quality, safety, and service than departments with lower scores. So 92% fewer workplace injuries, 57% fewer lost work days, 3% higher patient satisfaction. So, I mean, this really matters in every possible way. And like other healthcare organizations across the country with us on this journey, we know that adopting high reliability behaviors and having leaders that lead reliably every day will raise not just our scores, but more importantly, foster an environment where colleagues, employees, physicians, and patients speak up freely with ideas, questions, concerns, or potential mistakes without fear of being punished or humiliated. So let's take a look at how our leader standard work is affecting and impacting our employee satisfaction. We can go to the next slide. So this slide represents the national People Pulse data of the top 20% of departments. 7 higher, with staff stating, my leader rounds on me on a very important matters. And healthcare leaders are increasingly aware on an organizational outcome. And you can look here just how impactful this was on safety and harm. So in conclusion, we all just have a few minutes each I could talk about this all day. I love culture. I love high reliability. It's really paramount when it comes down to have joy and meaning for our employees. We want our employees to stay. We want them to have joy and meaning in their work. We want them to know that what they say matters. Providing these tools that we have provided through our education to frontline leaders and our clinical teams, we have just been amazed of how much it just prevents harm to our patients. It improves our clinical outcomes. It fosters psychological safety in the workplace, workplace injuries. So thank you very much for being able to share briefly our journey and what we're doing to be a safe organization, not just for our patients, but for our employees. So thank you, Ryan, so much.
Yeah, Rachel, this is great. And I did want to note you were cutting out a little bit there, but I think we caught the vast majority of what you said. But if there's anything you can do to adjust on your end, that's great. I just had a few questions. In particular, it looks like the rounding question from the People Pulse survey for Kaiser. I'm just curious, how often are you getting that data from your employees, and how often are you seeing that, and then sort of tying that to the safety pieces and the outcomes that matter for you?
Yeah, thank you, Ryan. That's a really great question. We survey biannually, twice a year.
Okay.
We send out that survey. And what's really great about the Glenn People Pulse survey is that when they give us our data, it not only tells us what we're doing great, which is great. We love to hear what we're doing great, sure. But it and really gives us ideas on action plans. And we take these action plans and we use multiple things. We use our leaders to share these organization-wide with their direct reports. We use our social media, Viva Engage. We use that to share. We ask our employees what we could do better. And we really involve them in the People Pulse survey and involve them in correcting and improving the processes, because it's really about them. They are our greatest resource. So that's how we do it. And it is just an unbelievable platform. Like I said, we love to hear what we're doing good, but more importantly, we want to hear where we can improve.
Yeah, absolutely. And I love what you said about, involving your people in the problem solving process. I'd say in 20 years of doing this, I would say that is one of the most common drivers of an employee's engagement level that I've seen, is that when they feel like they're involved in decision making that impacts their work in a positive way. And in healthcare, right, we all have the advantage of managing employees who, most of them, right, joined for a very specific purpose, right, to help people. And there's a lot of purpose and meaning in what they're doing. And if they're involved in that process of problem solving, and like you were saying about risk prevention, it's a really big deal. So to their engagement.
Yeah, I can tell you, Ryan, that our greatest ideas have come from our frontline.
Yeah, that is great. Just out of curiosity, so you kind of split these, you're seeing the significant correlations here, it looks like, to these outcomes with these survey metrics. I think the natural question for everybody, probably, if I were an attendee of this, right, would be, okay, what are you doing to both learn from your top 20%, and also what are you doing to help those at the bottom 20% at Kaiser?
I think what's really great about our organization is we are so aligned with each other. All 21 of our medical centers are so aligned. And what I will tell you, the secret, one of the secrets is, from our president down to the front line, everyone has the same message. Everybody is aligned. And I think that's what's very important about being a high reliability organization, is that we actually are showing and modeling what our employees expect of us as leaders. And that is, and with that, that's why, with all 21 medical centers being so aligned, and all of us being and having this collective mindfulness around safety, we share with each other. We learn from the best, and we learn from the people that aren't performing the highest. And that is what makes us so unbelievably successful, safe organization.
Yeah. Seems like it's really that focus on learning piece,
very
and
much
making sure to communicate and share across the organization. That is great. Thank you so much for sharing. Going to move on now, just in the interest of time. Thank you so much to our next panelist today. That's Corewell Health. So Janelle and Brian, I'll leave it to you.
Thanks so much, Ryan, and thanks, Rachel. That's such awesome work to see. Thank you for sharing that awesome data. So yeah, Janelle and I are here from Corewell Health. We can go to the next slide. You might not know who we are, but so I'll tell you just a little bit about us. Corewell Health, we're an integrated health system based in Michigan. We were formed with the integration of Spectrum Health in West Michigan and Beaumont Health on the east side of Michigan a couple years ago. We've got about 65, I think now up to 67,000 team members, a number of different hospitals, ambulatory locations across the state. And we also have a health plan called Priority Health that has about 1.3 million members. So excited to talk to you today about our journey to a new way of surveying safety culture. So a few years ago, We were probably in a space that a lot of other folks were in or are in that our safety culture survey and our engagement surveys were completely separate. And with our safety survey, it was all done internally, all homegrown. So there were these complex custom dashboards built within Tableau. We had a lengthy survey with negative worded questions targeted to different employee groups. So different employees were getting different types of questions. Because this was a one-off survey, our safety team had to use an employee file that was certainly not up to date. And so by the time the survey came out, between changes and restructures, the organization looked a lot different than what it looked like when the file was pulled. And again, it was a one-off, non-integrated survey, so it lived in a universe outside of any of the other surveys we were doing. So again, a few years ago, Janelle, myself, some others within our quality safety experience team and human resources, we brought our safety culture survey into the same platform we're using for our engagement surveys. And so with that, we were able to get modern dashboards, really easy to use, low learning curve. We could have short, simple questions that looked very similar to our engagement questions. We could utilize an automated employee data file. So the structure and the data behind the survey was contemporaneous to when the survey was launched. And then I think really importantly, it created a recognizable survey experience, both for the people taking the survey, the leaders using the reports, right? It created this cohesive experience where, people were getting emails about a survey and they knew what it was. They kind of knew what to expect. Okay, I get an email from Glint about a survey coming. I know it's not going to take me that long. I know how I can complete it. So just a nice experience for our team members. And then it gave us built-in action planning resources, right? So after a survey, leaders could go in and action plan on the questions, right? And Janelle could go in and tweak those plans so that they were pointing to resources specific to our organization, use terminology specific to our organization, right? So really, really powerful. And then probably one of the most important things is because we're in the same survey platform, we're now able to do within the same tool analytics against both types of questions, right? And so now we can look at, hey, what engagement drivers are driving our safety culture survey outcomes and vice versa, right? All really, really easy to do, even for our business partner team who may not be very experienced in analyzing survey results. And on this next slide, it brought a lot of cost savings, both tangible and not so tangible. We estimate it saved us about 80 hours of time, right? Again, we were creating, our safety team had to create those custom and maintain those custom Tableau dashboards, had to create their own employee file. We're doing that all in the same platform. We're utilizing economies of scale so that both our safety team and our HR team don't have to deal with troubleshooting questions during a survey period or training up leaders on how to use the tool. We can collaborate and do that together and just do it one time. And so that's really important for us as we're all, I'm sure you've experienced the same thing, asked to do more with less. We have to find ways to collaborate and leverage each other's strengths and not duplicate things, right? Just because we're in a different department. It also allows us to very easily deploy this annually, the full survey. We don't need to do a lot of work. We can get it out there. And it also means while we might be deploying the full survey annually, we can work in some of those safety culture questions that have larger organizational action plans. We can pulse on those in between that annual survey during our regular engagement surveys. So just really beneficial to us. Some of the intangible benefits, again, our leaders can access the results in the same platform as engagement. So we don't have to train them up on a new tool. It's not like they're building that habit. We don't need to retrain them every year on something that they haven't gone into. It's all the same reports and functionality. And so our HR teams are seeing the same reports as our safety teams. Again, we can help each other out with interpretation, with presentations, et cetera. And then again, our leaders can go to one place for all their action plans. They don't have to remember, okay, I go here for safety culture survey questions, and I go here for engagement, all in the same place, right? And it really helps us reinforce the post-survey behavior that we want from our leaders and teams. Regardless of the type of survey, when we're surveying our team members, doesn't matter the topic, we want to make sure we're doing something with that feedback. And so having it in the same platform, having it part of this overall cadence that we're surveying about every quarter, reinforces those habits that we want our leaders to be doing, which is after a survey closes, quickly getting in there, interpreting their results, sharing it with the team, action planning, and then more important than action planning, getting to action taking. And because our surveys are all part of the same overall program, even if a safety survey is not going to happen for another 8 months, because another engagement survey is coming up, it puts that time pressure on leaders to make sure they are doing something with the safety survey results, because just by fact of having another survey from the same platform come out maybe 3 months later, it forces leaders to make sure, hey, what did we do with those results? Did I share them with the team? Am I talking about what we're actually working on? And then finally, something else that really was advantageous for us is it really kind of nudged our quality safety experience team and our human resource team to work and collaborate with each other, right? Just by virtue of being in the same platform, using the same types of reports, it has created these just excellent opportunities to share best practices, again, help each other out. Whereas, with some of the other surveys we do in the organization that are not part of this program platform, they really are a lot more isolated, right? This forces us in a good way to collaborate. And then on the next slide, just talking a little bit, starting to talk about, well, how are we using this data? What are we doing with it? One of the things I want to talk about, an advantage we had of moving our safety culture survey to our engagement platform, we're able to enable comments in every question. So we've got a shorter survey, but comments allow our team members to provide color, nuance, detail about their responses. But as you can imagine, 67,000 employees, we get a lot of comments. So this is from our latest safety survey, which is just a subset, obviously, of the 67,000 team members, had over 20,000 comments. Some of our larger surveys that can get into like 35, 40,000. So we're using the typical things that you likely see in a lot of different platforms, keyword clouds, topic categories. But we're also starting to use generative AI. And so what we were able to do after our last safety survey in March is quickly comb through this comment set, give it prompts like, hey, summarize the top 10 ideas on what we should be doing to improve safety. That's built off of one of our open-ended questions. That'd be something that would take a long time to summarize. We were able to get some analysis out to our safety teams very, very quickly, and then click that down to our region level, to hospital level, right? Again, just trying to shorten the time between the survey and action taking. And this really helps us. We're really seeing this as a way to get that analysis out so we can get to actual action taking. I'm going to hand it over to Janelle now. She's going to talk a little bit more about what we're doing with these results.
Thanks, Brian. Appreciate that introduction to our survey. And I do have to give you kudos, because without you, I would have gone nowhere in the last 5 years with this survey. So thank you for that. So we really did see a need for one employee experience. And for anybody who's experienced an integration, especially one as large as ours, where prior to our most recent integration, we were a hospital system of about 13 hospitals, I believe. And then we adopted another 11. And so that's a huge load to take on. And we thought, how do we get to hear from all of these people during this? Because if you've ever experienced an integration, it can feel like kind of a nightmare at times. It's just a lot of understanding one another, where we're at, your teams, etc. And so we knew there was potential for silos. And we also know that sometimes there is an argument that silos are necessary in some regard, but not in quality or safety or experience or team member engagement. So we wanted to be sure that we tackled that early on to prevent silos in our surveying system, so that we could really capture the hearts and minds of our whole system, versus trying to combine data sets and analyze different survey results and see where we came up with. So we wanted to tackle that one early. And by combining them into a common platform, then we were able to develop a streamlined approach post-integration. So now it's, they came out with our new name, We Are Corewell Health, and all this new marketing to get everybody back to the same team. It can feel a little icky sometimes when you go through an integration, like you're sort of losing part of yourself. And they were really trying hard to prevent that and ensuring everybody is a part of Corewell Health. So post-integration, we really wanted to come together as human resources and QSE team to say we are a united front, and we are all here together supporting our system as a whole. And one of the ways of doing that is capturing that data collectively across the whole system. It did give us the ability to see the strengths and weaknesses as our newfound system. We all kind of knew bits and pieces about our historical data and where our opportunities existed. And unbeknownst to everybody, we all know communication is one of the hardest things to tackle, and also one of the largest impacts on safety culture. So we have that idea in our head, but we really wanted to see, as a new integrated system of 65, 67,000 team members, 21 hospitals, we wanted to see that at the system level. But the beauty of this platform is that it gives us the capability of really drilling down all the way to the unit level, the service line level. Let's look at just nursing. Let's look at just providers. Let's look at our ancillary team members and see, are we seeing a big variance in what the outcomes are, or is there still a pretty strong alignment in where our heads are at as it relates to safety culture within our organization? And we do see a lot of similarities across the organization, independent of the role. But there's a lot of similarities of where we're at, which tells us a couple things. We know where we need to focus our efforts. And we know, as we align with our system strategy, we can do that effectively because everyone's feeling the same way for the most part. So Brian had alluded to when we transitioned our safety culture survey from our previous survey platform into this one. And I just want to give a little bit of context to that. I know he mentioned some of the hours that were put into that, but to provide some perspective, the way that this looked, we had to develop those distribution lists, and that took us months to really make sure that we were lined up. Now, our entry-level frontline team members, we usually have on average a 30 to 40% turnover rate in a year. So you can imagine those distribution lists within a few months, we're definitely missing some people. In addition to that, once we were able to get those out, they came from an external name that not many people were aware of. So we really had to go on this marketing plan to make sure people know it's coming. We had to spend a lot of time in communication and kind of, hey, heads up on this, so that people didn't just automatically delete it, because that's common. And then once they were completed, people were anxious for results. Well, it took time to get those results back from our previous vendor. And then once we got the results, again, I would say we were up to nearly 100 human hours developing those Tableau dashboards for our leaders to use. Now, I don't know how many clinical leaders you all know in your space, but they are not the most familiar with navigating Tableau. So, and because Tableau was still kind of new into our system as well, then we had to take an extra 3 to 4 weeks just to educate our frontline leaders on how to navigate this dashboard. By now, we're 4 to 5 months into it, and the data's old. They're saying this doesn't even help me anymore. And that was the pattern we were recycling over and over and over until we transitioned into this platform. And now our leaders know how to get their results. They know when they can get their results immediately upon the survey closing. Our quality, safety, and experience team can look at that system level, and we can say, from a strategic roadmap, what makes the most sense to focus on so that we're staying aligned. We don't develop as a system any sort of detailed action plans. Instead, in this last case, we say exchange of information. This is a hot topic for us right now. We're on 2 different EMR platforms. We're working on integrating those. We know that exchange of information is difficult. That's going to be our focus. As a system, here's a couple things we're going to work on, but you as individual leaders, what can you do in your space over the course of the next year to drive exchange of information? It's going to be different at the unit level or at the departmental level. We are working with our emergency departments to inpatient. What does that look like? That's different from PACU to the ICU, right? So we're giving them a direction, but not detailed to where they can't be creative and collaborative in their own space, which gives them that opportunity to go to their teams and say, how do we make a difference in our space? And now our team members are we see that they're listening to this, they're coming back to us, and they're asking us for feedback on how we improve. So we can create that full loop communication as well. Next slide, please. In addition to that, we do provide what's called a holistic cultural assessment for, it could be a poll. So some people may come to us and say, hey, we're seeing some things. We're wondering if you can come in and do an assessment and help us understand where we need to provide focus. Or we could see data that's like those big red flags, and we go to them and say, we would like to propose this to you and the leadership team. And see if this is an opportunity you'd like to take us up on. And what that consists of is what you see here on the slide. So we do perform a psychological safety survey. We have our engagement scores, our safety culture scores, and then we also include our patient relations data, our actual harm data, and our patient experience data. And we kind of bundle it all together, and we do an overall analysis of it to really help our leaders understand, where are the correlations between all of these? Because at the end of the day, all of these things boil down to culture, and we need to understand where the gaps are within that culture. And then also B, how can we help? How can we advise? We can consult with them on some opportunities to improve specific areas. One of those ways, similar to what Rachel was talking about, is a high reliability program that we will put a leadership and all team members through. Could be we've done this at the hospital level, or we've done it at just a service line. This service line in particular may need some assistance. So we'll take them through what's about a 12 to 18 month high reliability program with at the hip support. So driving that work with quality, safety, and experience. And a lot of times HR is involved in that too, because we're really focusing on culture, and we know that that's important work for them too. So that's where we are at with utilizing this data. I can tell you, interestingly enough, our most recent survey, our response rates were not as great, and we have discovered why. So if you have a water main break in your largest city the same week, people's attention is diverted. That happened to us. We had a boil water advisory for almost 10 days, and it caused a lot of problems. We also know that the timing of the survey does matter. And so we work really closely with HR to make sure we're not causing survey fatigue, because it's like, oh my gosh, here's another one. So really trying to find a way that we can do this full survey and then effectively, as Brian mentioned, put in those questions that we want to focus on into that pulse throughout the year, so we're not having to cause any more survey burden. So yeah, that's all for me. Brian, do you have any questions for us?
Yeah, we do. We got questions coming in from the chat, so let's go right into the Q&A here. Brian, we have a question for you from Anne. She says, this is great. We're doing something similar. I'm wondering how you choose who takes the safety questions versus the engagement questions.
Yeah. We take a really broad view. We started that at Spectrum Health, and we've carried that over to Corewell Health. We basically include anyone who works physically in our clinical settings, right? So we include environmental services, nutrition services, registration, facilities folks. We take a very, very broad view. Really, the only ones who are not getting those safety questions are our health plan team members and our core corporate team members, your IT, finance, et cetera. But having said that, one of our questions is about employee safety. That everyone gets that, right? And so again, we just try to take a really broad view and be as inclusive as we can. We know that just because you're not in a kind of standard, certified licensed clinical role, you still play a very, very big part in the patient safety experience.
That's great. And there was a follow-up to that as well. Also curious if you can speak to how your medical staff are organized, employees versus contractors.
Yeah. We have a lot of employed providers. We also have a lot of independent providers that have privileges at our hospitals. We survey all of them. So we do include our independent providers in this survey, both for safety culture, but also for our standard engagement listening survey. We have to tweak some of those questions that are a little bit more about the employee-employer relationship, but our physician leadership feels it's very important that we are looking at our medical staff as one medical staff, regardless if they're employed or independent. And so they feel it's really important that we're serving these types of questions for everyone. So yeah.
That's great. Rachel, anything else to add in regards to kind of how your medical staff are organized, employees versus contractors?
Yeah, thank you for that question. Being an integrated health plan organization, we have the Permanente Medical Group who are our employees. So unlike other organizations, we may not have as much. We don't have the outside. We have our own medical group. So those would be, when we do, especially our patient safety on the staff level, we would query the physicians, and the data that we would get back we would be able to know by what group, whether it be respiratory therapists or whether it be nurses or whether it be physicians, how each are feeling. So because one group may feel differently than the other, right? Physicians may feel that they could speak up or not feel that they can speak up, different to maybe the frontline clinical staff. So it's a little bit different for us, Ryan.
Yeah. No, that's great. That's great. And I'll let each of the panelists answer this, and you can kind of argue amongst yourselves on who wants to answer it. But a question about a specific curriculum that you have to support managers in debriefing best practices.
I can start. We have, we actually, and I'm just going to say, when we debrief, one thing I love about our People Pulse data is it, again, gives us our strengths, gives us our weakness. And I always like to start with a high, and I always start with a thank you and end with a thank you, I kind of say. So when we give this to our staff and debrief, that is when we tell them, hey, this is where you said we were doing really good. This is where we aren't doing very good. And it really gives down to the specific questions of, I feel safe speaking up, and it's going to let us know how many of those questions were I absolutely agree, or I very much disagree. And then, you know, on each level, I mean, we certainly don't even want to be neutral, right? We want to be in that top, I agree completely. So that would be, it really helps us with that debrief. And I use the data that's provided as the specific tool for our action plans.
Yeah, one thing I'd add to that, as far as best practices for taking action on the results, we'll feed some of those best practices back into the template action plans, right? So if we're finding a best practice on how to improve one of these items, again, whatever the area, whether it's safety, whether it's well-being, whether it's engagement, we'll go in and add those best practices as resources within those action plans, right? And so that's just one way where we can nudge leaders to, you know, we want to make this easy for leaders. We don't want them to be reinventing the wheel, and we want action off of these surveys also to be relatively simple and straightforward. So that's one way we can feed that back in. And so if we're seeing something done well, we can add it as a potential action item for that particular question or domain. I'm not sure if that answered the person's question, but that's just one way we're trying to spread best practice.
I can add one other thing too. Rachel talked about rounding, and one thing that our organization is really trying to embrace even more than we were before is rounding to learn, and what we're calling more proactive rounding. So if we see a space that has really high scores in a particular area, instead of looking at what their opportunities are, we're going to go directly to them and say, what's going so well, and how do we share that to these other areas that are struggling a little bit more in these particular spaces or these particular domains. And that can be related to one specific thing. So inpatient falls. And you obviously are going to use this in combination with other data that's supporting this, but you're looking for those correlations and saying, you know, we know that this particular space has the least amount of falls throughout the entire organization. Now let's understand a little bit about the space first, but then let's go talk to them and say, what's working here? Because whatever you're doing is the secret sauce, and we need to share that. Versus going to the team that's struggling and slapping their wrists and saying, do better. And we want them to work with their peers and say, why don't you, the experts who have mastered this, go share with them, so we can just be that conduit for them by analyzing the data in correlation to other data sets. And I did just want to share one other thing that I thought of is utilizing the data, not just the Glint data and engagement data, but you can see the correlations. And I pulled just before this some of our results most recently. So those that we were seeing higher harm rates in the hospitals, we were seeing higher harm rates. And similar to what Rachel has done in their space, the HRO journey. What we saw over the course of the last 12 to 18 months is, in addition to reduction in harm rates, so in those spaces where we've done that, we've seen a 50 to 60% reduction in overall harm rates, but we've also seen a 15 to 20% higher response rate in our engagement survey. So we're seeing the correlations that are taking place, and they're doing increased rounding, and they're asking the teams what's going well and what's not, and they're engaging their frontline team members. We're also seeing their scores overall on an average of 5 or more points higher on nearly every question within that survey compared to company. So they're significantly improving in their engagement, and that's both engagement and patient safety survey. So we're tracking it, and we're seeing that. And really, when you start embedding those HRO practices, it's so much more than just safety. It's cultural, it's fundamental, and I do find it to be very effective. Rachel, I see your hand up.
Oh yeah, thanks. I wanted to dovetail on you a little bit when we, and I don't want to oversimplify it, because leader standard work and daily management systems are a very hard process to put in place and hardwire. And we've been on this journey for a couple years now. And, we're all 21 of our medical centers, 100% of every frontline leader and staff are trained on this. So when you use your, when you're looking at using your visual boards and you're using these every single day to share what we're doing great and what we need to work on and getting that frontline, part of that is the feedback that we get from our staff. So that daily standard work is literally our Bible to asking those, being able to give that information and getting that data back from our staff. So keeping them daily on where we're doing, if it's not from patient falls to happies to COTIs, but and also in satisfaction.
This is great. And Janelle, I want to get back to what you were saying about just the improvement that you've seen and some of the reductions or the improvements that you've also made simultaneously with patient safety. And it seems like a big theme is direct manager rounding and contact and visibility. And again, I don't want to oversimplify it, but is it that simple? It's just a matter of, leaders at multiple levels connecting with their people on the front lines more consistently, asking the right questions in a consistent way to bring about that change.
Mm-hmm. Yeah. And one thing, there's a lot of different ways you can do that, whether it be protected time to round. But what a lot of our frontline leaders were asking us was, what do we round about though? Because social rounding is one thing. How are your kids? How's your weekend? But at some point you got to get to that influential rounding. And so we would help provide them based on what's going on in their space specifically. And so we would help provide them some scripts and like, don't use these words on this, because then you're talking like Janelle, like put them into your own words, right? But then they would go out and they would also print a team roster. So some of our nursing managers have anywhere from 80 to 150 overall team members that report to them. And they would recruit some of their supervisors and leaders. And they would go throughout the month and check the box of who they've been able to round with so that they know their goal was to capture 90% of their team over the course of a month. And that was just a really easy way for them to do that and ensure that they're not rounding with the same people on the same shift, et cetera. And that was our children's hospital that was recently doing that. And they're seeing huge success in just the rounding component, but also with the other data.
That's great. I know we're coming right up on time. Maybe just to hear from each of our panelists one more time in terms of, what piece of advice, and what I promise to get to all the unopened or unanswered questions in the chat in just a few minutes. But for the interest of time, just what one piece of advice would you have, each of you, for the attendees today in terms of better aligning employee experience to culture of safety and really seeing those positive outcomes start to happen?
I'll take first. I think even if you can't get these two types of surveys in the same platform, just start collaborating with the two different departments, your HR department that probably has your engagement or standard employee experience metrics and responsibility, and your quality safety experience teams, right? And see where's that overlap. Some of the things that Janelle was talking about, you can do even if you're not in the same platform. It's a matter of sharing the data, being open and transparent with each other, and working together. I just think there's a lot that can be accomplished if we're not in silos. And even if you can't get them in the same platform, there's still a lot of information sharing and resource sharing you can do. And I think that's key if you are feeling really like your organization has those departments very, very separate.
Great. Janelle.
Yeah, I think I would say comments can be hard, regardless if it's engagement, safety culture, whatever the survey is. But I do think there's value in what people are feeling, and they want to hear feedback. So even when you're hearing the consistent staffing is the problem, or find some way to circle back. And even if you say we cannot solve for that right now, it's hard to say as a leader that we cannot do something, but team members wholeheartedly appreciate the fact that they know that you heard them. And you're saying, we heard you, we cannot solve for that today, but, and then try to spin it in some positive light. That is much better than ignoring. So find some way to provide some of that feedback.
Great. And Rachel, if you could bring us home.
Bring us home. Yes. Am I on mute? No. Okay. I just want to say that, again, everything that we do in learning from our employees is paramount. And I can't say enough about culture and how we learn. And thank you so much, Ryan, because again, we have to be able to answer the question, how do we know? How do we know? How do we know what we're doing? If it can't be measured, it can't be improved. And getting down to the details is how we're successful.
Great. Thank you so much. Just moving on to the next slide. If you're interested in hearing a little bit more, or you have further questions, please feel free to reach out. There's my email. You can also contact Jen Myers. She's also part of the Health and Life Sciences Employee Experience team at Microsoft Viva Glen. But just wanted to thank our panelists again. Thank you so much to the Leapfrog Group, and thank you to all of you for joining today. Hope you found it useful. Take care. Bye-bye.